Hi, I'm Alison and this is Bec, and we're speech pathologists at Newcastle Speech Pathology, and we're just going to answer a few questions that we often get asked about AAC. So Bec, what is AAC?
AAC stands for Alternate and Augmented Communication.
Okay, so who's it for? What does it look like?
It can really be for anyone. It's often used for people who struggle to communicate verbally, but it can be used just to support someone who is a verbal communicator.
Okay, so what are some examples of AAC?
So AAC can be just a piece of paper with some pictures of some common topics on it. It can be a flip book with lots of pictures and lots of words in it. It can be signs or gestures, and of course it can be technology as well. So there are lots of tablets and apps that we can use to communicate. You press buttons and the words speak for you.
Right, so there's many apps out there, as you've mentioned. I guess sometimes I get asked, which one should I choose? How do I know what AAC system is going to be suitable for the person I'm caring for?
So most of the time there isn't one AAC system that's right for one person. One person will often use multiple different systems of AAC at a time. So the best place to start is to talk to your speech pathologist and start off with an assessment of your communication and find out. You can trial some different things, see what works, see what you actually use, and go from there.
So what would be the best first step for me? I mean, are there people out there that I can talk to who are using these kind of pieces of equipment? What should I do?
Yeah, the very first place to start is to talk to your speech pathologist and get a full assessment of communication, but it can be really helpful to see other people using AAC. So whether that's finding somebody online who uses AAC and is sharing about their life, or finding someone in person and seeing how they use their AAC systems and how they're communicating. That can really help you sort of get an idea of how it might fit into your own life as well.
How severe would the communication problem be for someone to use AAC? Or is it something that just generally lots of people benefit from?
So a lot of the time AAC is used for people who cannot communicate verbally at all, but that is not the only way that it can be used. It can be used for young people who are still learning to speak and might just need a slightly different way of communicating early on. But it can also be used for people who can communicate verbally, but sometimes when they're feeling really stressed or when they're feeling sick, their communication isn't as easy for them, and so they can be like sort of part-time AAC users. So it really is something that can help a lot of people.
Great. So call your speech pathologist. We are very happy to chat here at Newcastle Speech Pathology. If you've got any questions, please let us know and we'd love to answer them for you.